In the last video, we had started with professionally applied topical fluorides, and professionally applied topical fluorides are high potency topical fluorides that are applied by the operator. So we had also started with what are the various methods of delivery of topical fluorides, which include solutions, gels, thixotropic gel, foam, prophylactic paste, and fluoride varnish. We had just begun with the description on fluoride varnish. So the biggest disadvantage of the first 5 mechanisms of delivery are about more than 2/3 concentration of fluoride that is applied gets diluted in saliva whenever it is applied as solutions or gels or thixotropic gels or foam or prophylactic paste, and this is a big matter of concern as far as the bioavailability of fluoride is concerned, and hence fluoride varnish is different from the other 5 mechanisms. That in fluoride varnish, the fluoride is added to an organic solvent, painted onto the tooth structure. The organic solvent evaporates and leaves a layer of fluoride on the tooth, enhancing the bioavailability of fluoride. So that is the advantage fluoride varnish has over all other mechanisms of delivery. So there are different types of fluoride varnishes. The first type is called the Durafet, which is a 5% sodium fluoride formulation in a viscous colophonium base. It has a concentration of 22,600 parts per million. The different types of fluoride varnish is the differences in relation to the concentration as well as the active ingredient or even the base that is used as an organic solvent. So Durafet has a colophonium base. It is a resinous base and it has a concentration of 22,600 parts per million. The floor protector contains 1% difluorosilane in a polyurethane base. The concentration is 7,000 parts per million. The third is called the Duraflor, which is very similar to Durafet. The only additional ingredient in this is the xylitol. Xylitol is added as an artificial sweetener, and xylitol is itself another polyalcohol, or it is a sugar alcohol which is having a anti-karyogenic effect. So there is a double protection as far as Duraflor is concerned. It is having fluoride as well as xylitol, which is anti-karyogenic. It is a bulk sweetener. Xylitol is a bulk sweetener that is used as a sugar substitute. The fourth is the cavity shield, which is also a sodium fluoride varnish. The only difference between cavity shield and the other sodium fluoride varnishes is that cavity shield is available as a single dose, as a unit dose. That is one single vial to be used for a patient. So it avoids unnecessary chance of over ingestion, or it prevents toxicity, and you have a controlled amount of fluoride delivery. So the only difference in cavity shield is that it is available as a unit dose. The next is called Fluoritop SR, which is one of the products that is manufactured in India. It also has is very similar to the floor protector varnish. And there is another varnish called Carex, which has around 18,000 ppm of fluoride. So these are the various types of fluoride varnishes that are used routinely. Now coming to the ingredients of fluoride varnish, I am going a bit in detail about fluoride varnish. As I told you, it can be asked as a short note question. So what are the ingredients is usually sodium saccharin is added as a sweetener, but in certain conditions even xylitol can also be added as a sweetener. It has flavoring agents, it has beeswax and ethanol, and it has shellac that provides it prevents the dissolving of varnish in the saliva, and it has a flow enhancer. These are all the additional ingredients other than the active fluoride ingredient, which is usually sodium fluoride. Now coming to the application of sodium fluoride, it is the decision regarding application is directly related to the caries risk of the patient. So there are different methods of estimating caries risk, and if the patient is at a risk of caries, a fluoride varnish application is indicated. So there are 3 frequencies that are usually recommended. One is one application every month, or one application 4 times a year, or 3 applications over a 1 week period. It all depends on the risk assessment of caries for a particular individual. So the technique of application, first and foremost, an oral prophylaxis is done, and once the tooth is cleaned using either a toothbrush or a professional oral prophylaxis is done, after that the teeth are isolated. Mostly it is isolated quadrant wise, and so one advantage these varnishes have is saliva promotes setting. So isolation is not a very important parameter, but still, so cotton rolls can be used for isolation. So when you are isolating, you are usually isolating it quadrant wise or sextant wise. And after that, the fluoride is, as per the manufacturer's instruction, it is dispensed, and it depends on the various types of fluoride varnish that is used. So with the applicator tip, it is painted onto the tooth structure, and it takes a few seconds to set and leave a layer of fluoride rich layer on the tooth surface. And overall, the procedure takes around 3 to 4 minutes. So the advantage of fluoride varnish, as we already told you, it sets rapidly, it reduces the risk of rapid ingestion. The saliva promotes the setting of varnish, so isolation is not a very critical matter of concern. Only small doses are required. Gagging or swallowing is unusual because you don't use tray. This is in contrast to the other methods of fluoride delivery, especially the gel where you use tray. The risk of dental fluorosis is minimum because not much of exposure is there, and the availability as far as the tooth is concerned is much higher when you use varnish. Indications and contraindications. The indications of fluoride varnish is caries prevention in children. Studies have shown that when twice a year application of fluoride varnish is there, around 35 to 45% reduction of caries experience is noted. It is also indicated in nervous children or in cases where there is failed pit and fillet sealant application, and there is rampant or nursing bottle caries, children with medical or physical problems, patients prior to orthodontic treatment, and the contraindications like any medication, history of hypersensitivity or allergy, or history of or the ulcerative lesions on the soft tissues that can the varnish can irritate these lesions, hence it is contraindicated when there is an active ulcer present in the soft tissue. So these are the indications or contraindications of fluoride varnish. Next, moving on to what are the various chemicals used to stopping fluorides. The most commonly used chemicals are neutral sodium fluoride, stannous fluoride, acidulated phosphate fluoride, and amine fluoride. We'll be discussing about these four a bit in detail. So before going to that, usually these are available either as solutions or gels, and when you talk about technique of application, there are two methods: the paint on technique, which is used for solutions, and the tray technique, which is used for gels. So with the method of delivery is the solution, we use a technique known as paint on technique, where the teeth are isolated and the solution is just painted onto the tooth structure. Whereas if it is the tray technique, you are simultaneously treating all the teeth together. You have foam trays, disposable foam trays on which the gel is loaded, and the patient is asked to bite on that gel which is placed in the tray. So that we'll discuss in detail as we discuss the individual chemicals that are used. So in general, these are the two techniques of application depending on what type of material is being used. So first, coming to neutral sodium fluoride. So these are all important short note questions. Your neutral sodium fluoride or stannous fluoride or acidulated phosphate fluoride, they have been very frequently asked as short note questions. First is neutral sodium fluoride was introduced by Bibby in 1941. The usual concentration you use is 2% and the pH is neutral. So how do you prepare this 2% sodium fluoride? Is when you dissolve 20 grams of sodium fluoride powder in 1 liter of water, it forms a 2% solution. So dissolving 20 grams of sodium fluoride in 1 liter of water, and you can bear it in mind that it has to be stored in a plastic bottle, because if it is stored in a glass bottle, the fluoride reacts with the silica of the glass, forming silicon fluoride, and it reduces the availability of fluoride. So always it is advisable to store this in a plastic bottle. So because this is a solution, we use a paint on technique, and the paint on technique for neutral sodium fluoride is known as Knudsen's technique. So next, moving on to what is Knudsen's technique. Knudsen's technique is a technique of application of sodium fluoride by a paint on method, and this is usually done as 4 appointments. Okay, 4 appointments that are spaced over 1 week interval. So 4 weekly appointments, 4 consecutive weeks. So the steps in Knudsen's technique: first is oral prophylaxis, isolation, and after that, with an applicator tip, the solution is painted onto the tooth structure, and it is allowed to dry. So once it is coated and allowed to dry for 3 to 4 minutes, and this procedure is repeated until all the teeth are covered. And after completion of treatment, patient is asked not to eat or drink anything for the next 30 minutes. And once that visit is there today, the next second, third and fourth visit are scheduled 1 week apart. So it takes overall 1 month to complete this application of sodium fluoride. So the basic disadvantage of sodium fluoride is that patient has to visit the dentist often, that is 4 times a month. So here always remember that whenever you are using sodium fluoride, it is just applied onto the tooth and allowed to dry for 3 to 4 minutes. Repeated application is not necessary over this 3 to 4 minutes. I'll tell you why it is so in the next few slides. So the mechanism of action of sodium fluoride is whenever sodium fluoride is applied topically, it reacts with hydroxyapatite to form calcium fluoride. So when you have tooth, you apply a layer of sodium fluoride, the surface layer gets converted to calcium fluoride, and this effect is known as the choking off effect. Now what is this choking off effect is, on the tooth surface when you apply sodium fluoride, a layer of calcium fluoride is formed superficially. This layer of calcium fluoride prevents further entry of sodium fluoride. So that is the reason when you are using sodium fluoride, you are just applying the solution once and allowing the solution to dry for 3 to 4 minutes. There is no point in repeatedly keeping the tooth wet like other fluorides. When you talk about stannous fluoride and APF, you know that whenever you apply, you keep it continuously. Every 30 seconds you go on adding that stannous fluoride or APF, whereas in sodium fluoride that is not necessary because of choking off effect. As soon as a layer is applied, a layer of calcium fluoride is formed that prevents further entry of fluoride. This is known as choking off effect, and this calcium fluoride acts as a reservoir from which the fluoride slowly goes into the enamel and converts hydroxyapatite to fluorapatite or fluorhydroxyapatite. And that is why you require 4 consecutive weekly appointments, because by the time the patient comes next week, that calcium fluoride reservoir would have got converted to fluorapatite or fluorhydroxyapatite, and hence you require 4 consecutive weekly appointments. That is because of the choking off effect that is created by calcium fluoride. So the advantages of sodium fluoride are, it is relatively stable when kept in plastic containers. The taste is well accepted. It does not cause any discoloration of teeth. It is non-irritating to hard tissues and soft tissues, and it does not cause discoloration. So the disadvantage mainly is that patient has to keep visiting the dentist 4 times 4 consecutive weekly appointments. So that is regarding sodium fluoride. All the advantages and disadvantages measured are in comparison to the other methods of delivery. So when we talk about stannous fluoride and APF, these advantages and limitations are in comparison to each other. So that is regarding sodium fluoride. The next video will be continuing with stannous fluoride. Thank you.